Assalamu alaikum everyone and welcome to Experience Dentistry. I am Dr. Alishpa Sajjad and today we have Dr. Naghman Zuberi with us and he is going to discuss very important topic which is setting up of teeth in complete denture, which is important in theory as well as in practical, and balance articulation. Thank you very much sir for your time.
Thank you very much for inviting me and letting me discuss this very important topic. Good morning, everyone, and welcome to this lecture. Actually, I was getting a lot many queries from different students, from those who are aspiring for the board examinations and those who are in final year dentistry in the undergrad level. So they were asking me to discuss this topic, and that's why we are here. So actually, why the setting up of denture, the teeth in the dentures is very important. First of all, what is happening nowadays? There is better survival of human population because of some advanced life support modalities and technologies, and definitely the average age of human being has almost increased. So it is leading to more aged people with edentulism. The reason is teeth they get lost because of negligence, especially in the later ages because of chronic periodontitis. So most of the elderly people after a certain age, they lose either their partial dentition, and some of them definitely they lose their complete dentition. To improve their lifestyle, to improve their uh, uh, standards of living, we need to replace the missing teeth because they are required for multiple reasons, including nutrition and aesthetics, and definitely for phonetics as well. Well, complete denture restoration designs they need to meet specific mechanical, biological, and aesthetic requirements. We have divided this topic into three parts. So today we will be discussing part one. Selection criteria for the anterior and posterior teeth will be today's topic. Then the next lecture will be on setting up of the anterior and posterior teeth. And then finally, in the third lecture, we will be discussing balanced articulation for complete dentures. What is the difference between natural dentition and artificial complete dentures? So how we utilize the compensatory curves and all that while setting up the teeth before trial in the complete dentures. We will discuss all that. So the clinical first step towards teeth arrangement is the teeth selection. During the occlusal registration stage, the position of the anterior teeth and the selection of size, shape, and shade is incorporated. It is not that after just you have taken the maxillomandibular relationships, including the face bore records, vertical, centric, and protrusive, and you dispose of the patient. No. Before disposing of the patient, after the maxillomandibular records, do the needful so that additional visits of the patient will be avoided. And you will also not having frustration that, oh, I have selected the wrong shade or wrong mold or wrong size. So we have to let the patient seated in, and then we have to perform certain steps. The size of the anterior teeth is very important because otherwise aesthetics are going to be impaired, and definitely it will affect the phonetics as well. To establish the overall width of the six anterior teeth, the distance between the canines can be determined using various methods. marking the corners of the mouth on the rim with the mouth at rest, measuring the width of the nose at its widest point with the mouth at rest, and add 5 millimeter to this measurement to allow for the curvature of the teeth. The width of the two central incisors may be estimated using the philtrum width as well. The height of the central incisor should be equal to or greater than the height of the smile line above the incisal edge. And this high smile line should ideally be marked onto the wax rim of the registration rim during the registration stage by the clinician. We will discuss it in detail in our next lecture. Very important point is, and the common mistake we do, we actually use the normal Vita shade guide for shade selection of the acrylic teeth. That is not correct. Always use the special synthetic polymer teeth shade guide. Though the shade over there are almost the same, but some additional chroma levels you will be able to see. The hues would be the same, but here you can see A0 as well. This is an important point because in Vita shade guide, the classic Vita shade guide, you won't be able to see the A0, and that is present in the synthetic polymer teeth shade guide. So use the shade guide which is specific for the polymer teeth instead of using the porcelain shade guide. Color is described using the terms value, chroma, and hue. Well, we can arrange a separate lecture on the attributes of color differently and how to take the shade. We will discuss that in a separate lecture after this series. If anyone is interested, you can let me know and we can go for that. In general, darker teeth should be selected for the older patients. This is a rule of thumb because lighter teeth will be very easily identified by the observer and they look slightly like artificial. People will be having a feeling that this person is having artificial dentition or artificial set of teeth. Then comes the shape of anterior teeth. Various methods have been described by different authors and clinicians to select the shape of the artificial teeth. Use the patient's old dentures if they are present, and if the patient is happy with their teeth, they just need a new set of teeth after a couple of years they have used it. So you are replacing the old dentures. So go with the same mold, same shade, same shape if patient are satisfied with that. Select teeth based on the inverted shape of the patient's face to determine whether the teeth should be squarish, tapered, ovoid, or oblong. So here we can see the different facial forms, and that's how the teeth are going to be selected, as well as based on the shapes of the arches as well. Masculine and feminine molds are always available for selection. You can, if you are using some like expensive set of teeth, so they will also always have the masculine sets different and feminine sets different. Then we also check for the posterior teeth, their size. Most important point is buccolingual width. It should be sufficient to act as a table to hold the food, which we call the occlusal table. If it is not sufficient, then there won't be efficient mastication. But it should be less than the width of natural teeth. Not to encroach on tongue space and on the buccal corridor. Well, they should always be directing the occlusal forces or masticatory forces at the right angle to the ridges. For the posterior teeth size, the mesiodistal width is also important. We need to fill the edentulous space available, but keep in mind for that, though you are placing it as far as posterior possibly, but do not begin like place it over the beginning of the ascending ramus or in the retromolar area. Otherwise, the dentures are going to slip. We will discuss it in detail when we will be discussing the second part next week. What are the do's and don'ts? Then comes the occlusogingival height from the top to bottom, determined by available interridge space, occlusal plane, and height of anterior teeth, teeth with the largest possible vertical length that can be used without grinding are preferred for the aesthetics. Occlusogingival height. Posterior teeth are either anatomic teeth or they are non-anatomic teeth. Anatomic teeth, they are being used for those patients with aesthetic concerns, coordinated jaw movements, and the denture is opposing the natural teeth. Non-anatomic teeth, they are used for those patients where there is insufficient overbite with normal overjet, or if they have a class 2 or class 3 skeletal relationship, if there are severe ridge resorption, or if because of any neuromuscular reason there is an uncoordinated jaw movement, maybe TMJD or some other reasons. Anatomic teeth, they are cusp teeth. They are also called cusped teeth. They simulate the occlusal surfaces. Varying degrees of inclination are present, like 10-degree cusps, 20-degree cusps, 30-degree cusps, and 40-degree cusps. The standard or average is 30 degrees cusps. The cusp incline less than 33% is 33 degrees is termed as semi-anatomic teeth. Non-anatomic teeth, they are cuspless. They are also called as 0-degree teeth or monoplane teeth. They offer less resistance to the horizontal forces because there are no cusps, so sliding is possible. Disadvantages is shearing efficiency and is not sufficient, and poor aesthetic, as well as lateral and protrusive balance is not possible. That is very important point, that when you are giving non-anatomic teeth, then balanced articulation is slightly difficult. We can attempt it, but it is slightly difficult. Then comes the material of teeth, whether we are going to place the porcelain teeth or the acrylic teeth. Porcelain teeth in the posterior, there is a very big disadvantage, and that is clattering sound. That is why acrylic teeth are preferred in the posterior region, whereas and porcelain teeth are aesthetically very pleasing, very acceptable, so they should be used in the anterior region. Let's see certain their advantages and their certain qualities. Porcelain teeth on the aesthetic, very high, whereas acrylic teeth, they do not have very good aesthetics, so it's a disadvantage. Attachment to the denture base, this is also very important, how we are going to attach the teeth to the denture bases. Porcelain teeth, they do not bond chemically with the polymethyl methacrylate, so we need to take the advantage of some mechanical retentive means. That is our disadvantage. Whereas acrylic teeth, they chemically bond to the polymethyl methacrylate denture base, and that is an advantage. Density of porcelain teeth is higher, it is a disadvantage. Of acrylic teeth is lower, which is advantage. When you are using porcelain teeth, the dentures, they become quite heavy. Brittleness of porcelain teeth is higher, which is a disadvantage. If the dentures they fall on the floor or any other impact force is there, chances are that they get fractured. Whereas acrylic teeth, they can easily bear the impact force, and the chances are that they are not going to chip off. I have already mentioned about the compatibility with the denture base. So porcelain teeth, they do not bond, and that is lower. So it is a disadvantage, but it is higher in the acrylic teeth, so it's an advantage. Hardness. It is higher, which is advantageous by less abrasion of the denture teeth. Whereas acrylic teeth, they can get abraded if they are facing the natural dentition or any porcelain crown or porcelain bridge or any other restorative material. But hardness is also a disadvantage for the porcelain teeth. Adjustment would be very, very difficult. Whereas acrylic teeth can be adjusted very easily. Forces to the supporting soft tissues, porcelain teeth higher, which is a disadvantage. And if you have done some occlusal grinding and there is natural teeth opposing, then there would be a chance that there will be high attrition of the opposing natural dentition. Whereas forces to the supporting soft tissue from the acrylic teeth is lower, which is advantageous. Tissue biocompatibility of the porcelain teeth is very high, whereas acrylic teeth is low, so it is a disadvantage. I personally believe in using porcelain teeth in the anterior region, as I have already mentioned, because here we can have better aesthetics. And in the posterior region, acrylic teeth can be used. The uh, porcelain teeth, they need mechanical retention. That is why these buttons or studs or even at times the grooves, they are present on the fitting surface of the porcelain teeth. Whereas cross-linking is possible in the acrylic teeth. So just don't let the separating media touch the fitting surfaces of the acrylic teeth, and they will get chemically bonded to the denture based material, which is polymethyl methacrylate. Well, retention of these teeth with the denture base can be achieved by gross mechanical retention, as I have already mentioned about the holes, pin, and undercuts. Micromechanical retention is also possible using burr roughening, grinding, sandblasting, etc., etc. And chemical bonding, that is possible only in the acrylic teeth, the denture-based monomer penetration into the teeth. So it minimizes the interfacial leakage and staining, hygienic and aesthetic problem, and facilitates the stress transfer, preventing cracks or creases near the interface with base. So over here, just I have given you a brief introduction how we can select and make a plan beforehand which teeth we are going to use and in which region, or what would be our preference, what are the advantages, disadvantages, what criteria we should keep in mind for selection of the teeth. So next Monday we will be discussing now the lab procedure after some this clinical procedure, and then we will go for the lab procedure, how to do the setup. Firstly, we will discuss about the landmarks which we are going to put in patient's mouth while the upper and lower denture, like the denture bases or the record bases, are in patient's mouth. And then we will proceed with the setup. So see you tomorrow, like next Monday, and we will continue from here. Thank you very much. And any queries, any questions will be more than welcome. Thank you, Alishba.
Thank you very much. Thank you very much, sir. Thank you everyone for viewing this lecture. If you have any question, you can post in the comment and Sir will answer your
Or
questions.
they can send it direct to me, or they can send it to you guys, and you can send those questions to me, and I will address it.
Thank you very much, sir.
Thank you. Assalamu alaikum. Allah Hafiz.
Allah Hafiz.